Coming to preventive lifestyle tips for maintaining a healthy heart is that, yeah, nowadays we come across very young patients like less than 35 years or furthermore less than 45 years with heart attacks. So preventive measures could be, see nowadays we can see that there is a lot of physical inactivity and abnormal food intakes, abnormal eating habits. And thirdly, one important thing is they are more inclined to have smoking and ethanol alcohol consumption like that. And when patients are appropriately diagnosed with hypertension and diabetes, and they were advised to take proper medications, they are not sticking to the treatment factors, and because of which they are progressing into the advanced complications like heart diseases, which are like heart attacks and or ischemic strokes or peripheral vascular kind of things. So it is very important that they manage, they adapt healthy lifestyles, decrease physical inactivity, increase your activity, and have healthy food habits, and have this adhere to the prescriptions given for the diabetes or hypertension.